JIPMER is one of the oldest medical institutions in the country. Regional Cancer Center in JIPMER was started in the year 2009. The hematopoietic stem cell transplant, commonly known as bone marrow transplant or blood and marrow transplant, program was started in JIPMER and the Department of Medical Oncology in January 2013. First autologous transplant was done in February 2013. First syngeneic transplant was done in April 2014. And first allogenic transplant was done in July 2014. JIPMER was empaneled in Tamil Nadu Health System project under the category of Specialized Procedure for Bone Marrow Transplant in April 2015. Our current bone marrow transplant unit is 2-bedded and is well equipped with biosafety laminar hood for sterile chemotherapy preparation and stem cell cryopreservation. Deep freezer for stem cell storage. The transplant rooms are provided with air shower, laminar flow and HEPA filter for infection control. Stem cell collection is done by apheresis in a special apheresis equipment in the Department of Transfusion Medicine. Type of transplant includes autologous transplant where the stem cells are collected from the patient himself or herself. Syngeneic transplant where stem cells are collected from the identical twins, and allogenic transplant where siblings, either brother or sister or an unrelated individual, is the donor of stem cell, which is done after a proper HLA matching. The stem cells can be collected from peripheral blood after mobilization or from the bone marrow or rarely from umbilical cord. Because in recent years, stem cell collection for majority of patients is done from peripheral blood, the name has changed from bone marrow transplant to blood and marrow transplant. Common indication of bone marrow transplant are malignant hematological disorders like leukemia, myeloma, and lymphoma, solid tumors like germ cell tumors, neuroblastoma, and non-malignant hematological autoimmune disorders. Depending on the disease characteristics, type of transplant varies like autologous transplant is done for myeloma, lymphoma, and allogenic transplant is done for leukemia and other non-malignant hematological disorders commonly. Major steps involved in stem cell transplant are: number 1, cell harvest storage, which includes mobilization, stem cell collection and cryopreservation. Number 2, preparing of patient with high dose chemotherapy. Number 3, infusion of graft or stem cells. Number 4, management and monitoring of various complications after stem cell transfusion. The stem cells used in PBSCT come from the bloodstream. A process called apheresis or leukapheresis is used to obtain PBSCT for transplantation. For 4 or 5 days before apheresis, the donor may be given a medication to increase the number of stem cells released into the bloodstream. In apheresis, blood is removed through a large vein in the arm or a central venous catheter. The blood goes through a machine that removes the stem cells. The blood is then returned to the donor and the collected cells are stored. Apheresis typically takes 4 to 6 hours. The stem cells are then frozen until they are given to the recipient. After being treated with high-dose anti-cancer drugs and or radiation for 5 to 7 days, the patient receives the cryopreserved stem cells after thawing through an intravenous line, just like a blood transfusion. This part of transplant takes 1 to 5 hours. After entering the bloodstream, the stem cells travel to the bone marrow where they begin to produce new white blood cells, red blood cells, and platelet in a process known as engraftment. Engraftment usually occurs within about 2 to 4 weeks after transplantation. Doctors monitor it by checking blood counts on a frequent basis. Complete recovery of immune function takes much longer, however, up to several months for autologous transplant recipient and 1 to 2 years for patient receiving allogenic or syngeneic transplant. Doctors evaluate the results of various blood tests to confirm that new blood cells are being produced and that the cancer has not returned. The major risk of bone marrow transplant is an increased susceptibility to infection and bleeding as a result of high dose cancer treatment. Doctors may give the patient antibiotics to prevent or treat infection. They may also give the patient transfusion of platelet to prevent bleeding and red blood cells to treat anemia. Patients who undergo bone marrow transplant and PBSCT may experience short-term side effects such as nausea, vomiting, fatigue, loss of appetite, mouth sores, hair loss, and skin reactions. As bone marrow transplant is an intensive procedure, there is a risk of life-threatening complications and mortality risk of which varies depending on the disease, response, and patient general condition. On an average, transplant-related mortality in first 30 to 100 days of transplant is 3 to 8% for autologous transplant and 10 to 15% for allogenic transplant. Besides the acute complications, there are also long-term side effects of transplant such as infertility, cataracts, secondary cancers, and damage to the liver, kidneys, lungs, and or heart, and GVHD. Bone marrow transplant is a teamwork. Hematopoietic stem cell transplant in patient is done with coordination of other main departments such as transfusion medicine, hematology, pathology, immunology, microbiology, radiotherapy, dietetics, medical social worker, and auxiliary departments like ENT, dental, psychiatry, and pulmonary medicine. We conduct transplant clinic every Monday for review of pre- and post-transplant cases or patients. We counsel the patient and primary caretaker and get concern regarding stem cell transplant, fund arrangement for drugs, blood donor screening, date of harvest, and admission plan are done in the clinic. Total number of hematopoietic stem cell transplant performed from the start of bone marrow transplant in January 2013 till July 2016 is 57. Total number of autologous transplant is 50. Total number of allogenic transplant done is 7. This includes 15 patients who had undergone transplant with financial support from Tamil Nadu scheme during the last 1 year period from July 2015 to July 2016. Graph shows the most common indications of transplant for myeloma, lymphoma, and leukemia. Patients in waiting for transplant are average 6 to 8. 19 patients were approved after attending bone marrow transplant committee meeting. Of them, 11 patients had undergone transplant. 7 cases were cancelled for medical reason and 1 patient is in waiting. Additionally, 4 cases were done by pre-authorization.
என் பேர் ஜெயன், 37 வயசாச்சு. ஊர் வந்து கோயம்புத்தூர் மாவட்டம் காரமடையில். இது என்னோடய ஒய்ஃபு. எனக்கு வந்து புற்றுநோய் இருந்ததுங்க இந்த இடத்துல. இஎஸ்ஐயில் காட்டினேன். அவங்க வந்து இங்கே முடியாது, ஜிப்மர் பாண்டிச்சேரியில் காட்ட சொன்னாங்க. அப்புறம் அங்கே வந்தோம். அங்கே வந்து பயோப்சி எடுத்து பார்த்தாங்க. இப்போ கேன்சர் புற்றுநோய் இருந்தது. அப்போ காசுக்கு என்ன பண்ணுறதுன்னு ரொம்ப கஷ்டப்பட்ட டைமில் தான் அம்மா காப்பீடு திட்டத்தில் போய் மீட்டிங் அங்கே போனோம், சென்னைக்கு போனோம். அப்புறம் அவங்க தான் காசு ஹெல்ப் பண்ணி ட்ரீட்மெண்ட் பண்ணாங்க, உதவி பண்ணாங்க.
Of the 15 patients who had undergone transplant, 12 patients are alive and 3 patients died during the first 100 days of transplant. We aim to emerge a center of excellence for bone marrow transplant in southern India and expand our service to match unrelated donors, cord blood and haploidentical transplants.